Adding to the stress of pregnancy and a global pandemic, moms-to-be are now facing a crucial decision. Should we take a rapidly developed vaccine to protect against a deadly virus, one with no hard scientific data yet on how it affects us and our pregnancy?
It's a tough decision for all people out there who are looking to try to do things to prevent COVID in themselves and their families.
Here in the U.S., an estimated 330,000 healthcare workers are pregnant or lactating as they battle the pandemic. Dr. Jackie Spiegel at Harbor UCLA Medical Center is one of them, 36 weeks pregnant with her second child, a boy.
How has it been for you mentally, emotionally, being a doctor, fighting COVID, and also wanting to protect the little baby inside you?
It's been a lot. It's been really stressful.
She says treating pregnant patients struggling with COVID helped her decide that, yes, she would get the Pfizer vaccine. But the decision was by no means easy.
Medically, I felt like, okay, this is probably safe. And then the emotional side of me said I'd never forgive myself if something happened to my unborn baby. Pretty much everyone said, weigh the risks and benefits. And so I said, okay, I'm going to hold off until I talk to my OB. And that was really the deciding factor when he told me, if it were my wife, I would tell her to do it.
Once the vaccine is widely available, millions of expectant moms will face the same choice.
Show of hands, who plans on getting the vaccine if it becomes available to you?
Laura Shea and Latoya Webley have weighed the risks, landing on two different sides of the coin.
It just seems that if you get COVID, the risks are so much higher. And not just for myself, but for my baby. That's why I'm mainly choosing if I have the option to take the vaccine.
I just don't want to risk anything. I'm thinking for two people, and I just want to err on the side of caution and just wait and see what's going to happen and what other new information comes about.
Latoya says her decision is also driven by a painful history of medical experimentation on Black Americans.
There's just a lack of trust and a history of mistrust. And I think moving forward cautiously is always going to be the route that I'm going to take.
The American College of Obstetricians and Gynecologists say pregnant women should have access to the vaccine, that they shouldn't be excluded, but stops short of a recommendation. Dr. Geeta Swamy helped write those guidelines.
Right now, we really have to rely on what we know about how the vaccine works and what we know about the course of COVID infection and pregnancy. I think ultimately it comes down to a decision of understanding the risks and benefits.
In the U.S., there's no live virus in the vaccine. It triggers an immune response, causing your body to generate antibodies to protect against COVID-19.
Generally speaking, we don't have a concern that the vaccine would cause harm in the pregnant woman herself or her baby.
Do you feel like ultimately you made the right call?
Absolutely. My advice would be to listen to the side of you that's going to have to live with your decision, to not reject this because of the lack of data.
These women trusting their maternal instincts before their babies arrive.
At the end of the day, we just want our babies to be healthy, and we want to be healthy. So we have to just do what's best for ourselves.
Now, according to Dr. Swamy, vaccine trials for pregnant women are expected to start in the next few months, so that's good news. So she estimates we're still, though, probably about 8 months from having any good data to rely on. And there's one piece of misinformation, by the way, Dr. Swamy wants to clear up for those who are not yet mothers. She says scientifically it is impossible for the vaccine to cause infertility. But, you know, I got to ask all of these amazing doctors all of these questions. It certainly helped inform my personal journey, and it was just a really eye-opening experience to learn more about where we are with the science right now, guys.
Yeah. You have all of us talking, Joe, right now. Would we do it? Would we not? I mean, big time decisions, you know?
Huge.
Such a personal story for you too, Joe. So good luck with your decision.
Wow.
Thank you. I'll keep you posted.
Yes, please do.
Hey, when do you do, Joe?
I am due in the spring and early May. So the question really is, when you think about the vaccine, will it be available to journalists like us? And then if it is, you know, what that decision is going to be. But I've been talking to my OBGYN as well, having that conversation. And I just love how all the women in our piece, they went with their gut based on the information that they have. That is the right way to go.
That's all you can do. To trust right now.
Yeah.
Thanks, Joe.
The best you can.
Thank you, Joe.